We've got a good bunch today. Look at that.
Yeah.
I'm in.
Yeah. It's a hot topic. I've been hearing so many people talk about this. So I'm really glad that we're going to share all of this. I'm so glad Olga's going to be here to talk about it.
Yes, it's so great to work with you on this. So as you come in, I just wanted to pop on. I will pop off shortly, but to introduce Mandy and Olga and Small Brooklyn Psychology. I met Mandy at a meetup at Whole Foods. She was pumping in the car.
This is your favorite story. Listen, I'm very efficient. Very efficient.
And she is so efficient at running Small Brooklyn Psychology that if you have needs for the well-being of your children, I highly recommend Small Brooklyn Psychology, and I can tell you more about what all of the range of things that they do. But just so happy to have you talk to us, and not only managing our kids' stress, but yours as well. So turning it over to you.
Thank you, Susan. I really appreciate it. Thank you so much for coming, everyone. Welcome to our webinar on managing kids' distress, and yours, as Susan said. So today, Dr. Olga Fuller is going to talk to us about kids' anxiety and uncertainty, how we can help, and also when we shouldn't. So I am Mandy White-Ajmani. I am the owner of Small Brooklyn Psychology. We are a group psychology practice in Industry City in Brooklyn. We offer therapy and neuropsychological assessment to people of all ages, all backgrounds, and all psychological concerns. So down there at the bottom of our slides, you can see all of our clinicians. That's me, Natasha Brown, Rebecca Abbott Sinclair, Sam Janit, our newest team member, Megan Moxie, Nav Gill, Ben Janitis, Maddie Lawler, Danielle DeFilippo, and our speaker today, Olga Fuller. We all have experience with working with people across the lifespan, but we also have special training and experience to work with children and parents using evidence-based assessment and treatment. And we haven't done one of our webinars in a while, so I'm really excited to share all of Olga's expertise with you. One of my goals has always been to try and share what we know with the community. And we've actually developed a lot of great content over the past 3 years, and I'm really proud of that. We cover a lot of different topics in our different talks, from tips on managing behavior at home and in a classroom, to what a neuropsychological evaluation is and how it can help you, to understanding mental health issues in children and adults, how to take care of yourselves as parents. All of those recordings for our previous talks, they're available for free on our website at smallbrooklyn.com/services/talks. And then, as Susan Fox, the illustrious leader of Park Slope Parents, they have been our long-term partner in this. They are really the OG in disseminating information to parents, and I'm really grateful to the whole team, Park Slope Parents team, and the community for partnering with us in all of these webinar series. If you are a parent, even if you're not in Brooklyn, I highly recommend that you join Park Slope Parents. It's been such a huge help to me and to my family personally, as well as to the community as a whole. It's been a wonderful source of connection in person and online. Now, during this talk, if you have questions, I would like for you to type them to me in the Q&A box. I will be monitoring that. So we'll get to a Q&A discussion at the end of the talk. And without further ado, I'm going to introduce Olga. So Dr. Olga Fuller is a clinical psychologist and postdoctoral fellow at Small Brooklyn. She's currently supervised by the wonderful Dr. Ben Janitis. Olga earned her PhD in clinical psychology from St. John's University and is trained in many clinical settings, such as New York Presbyterian, Zucker Hillside Hospital, and New York City's Children's Center. Olga has extensive training and experience in treating behavioral, emotional, and social difficulties, including depression, anxiety, anger management, trauma, suicidality, self-harm, OCD, tics, phobias, interpersonal difficulties, many more that probably are not on this list. She works directly with kids and adolescents, but she also works directly with parents too, because sometimes the best outcomes for kids can come from helping parents adjust their own behavior and to reframe the environment for their kids. She is also, by the way, bilingual in English and Russian and is able to provide services in either language. And she's a Brooklyn native and a mom to an adorable young boy, and we are just so happy to have her on our team. So Olga, I'm going to absent myself and take it away, and I'll see you again at the end for questions.
Thank you, Mandy. It's great to be here. Hi, everybody. Without further ado, I'm just going to jump right in to talking about managing kids' distress and yours. I'm going to start off by talking a little bit about a cause for concern. So we've all seen the trends and the recent headlines about mental health concerns for kids and teens being on the rise. A 2021 CDC survey reported that 3 in 5 adolescent girls stated feeling persistently sad or hopeless, and that 30% have reported considering dying by suicide. So these are really jarring and really concerning numbers, and it's no wonder that, according to this chart right here, that this tops the list of parental concerns, right? Parents are most worried about their children struggling with anxiety or depression over and above things like being bullied, being kidnapped, having problems with drugs or alcohol. And so as parents, when we hear about these trends, when we hear about this, whether it be from the news or anecdotally from, other parents, from our own kids in school, we tend to feel really anxious. And I want to focus on that anxiety for a minute. So, we want to talk about our kids' anxiety and depression, but I want to stop for a second and talk about anxiety as a whole and what role this might be playing for us as parents. So anxiety in a nutshell is our body's alarm system. From an evolutionary perspective, anxiety is really important, and it can actually be very functional because it's meant to keep us safe. It's meant to protect us from threat and from danger. And when we feel threatened with danger, our brains go into, we've all heard fight or flight, but here I want to talk about fight, flight, or freeze. So, when we're faced with a threat, we may be tempted to fight against the threat to keep us safe. Thinking about, from the earliest days of humans potentially getting attacked by a bear or something of the sort, we might have an instinct to fight against it to keep ourselves safe, or we might want to run away, hide, run away from the threat and keep ourselves safe, or we might freeze, being completely paralyzed and unsure of what to do in that moment to keep ourselves safe. This doesn't just apply to threats to our physical safety. This applies to threats in our everyday life, right? So that looming deadline at work can feel like a threat. Our kids telling us, hey, I'm really nervous about going to school tomorrow. So that can feel like a threat. And so we respond in much the same way as we would to a threat to our physical safety. And I want to talk about how that plays out and what that means for us as parents. So when we feel anxious about something related to our children, right, the most important things in our lives, the most important humans in our lives, we may jump to a couple of different ways of approaching the situation. So we may go into flight mode, which would be avoidance, right? We avoid the uncomfortable situations. We may kind of push it aside, pretend like it's not happening, deny and say like, oh, I'll deal with that later. I'm not going to have that conversation right now. I can't possibly deal with this. I think we can all probably guess why that's not a particularly helpful response, but that's also not the only response that some of us default to. I'll talk about some of the others in a little bit more detail in the upcoming slides, but the constant worrying about your child, I think, is prevalent for many of us. So one way that we deal with our own anxiety about our children is we become overprotective. So overprotection can look like a number of different things, but the term helicopter parent gets thrown around a lot. And it's really a matter of trying our best to shield our kids from any sort of potentially threatening situations, right? Real or imagined. It can look like micromanaging our kids' routines. So for our adolescent kids, maybe saying like, you're actually not allowed to ever go anywhere without me. I have to be with you always, which might feel safe in the moment. It might feel good, a relief of that anxiety, but it never gives our kids a chance to have some of that independence and say, oh, well, maybe I can go and hang out with my friends without my parents there for some amount of time. So we gradually work up to me developing more independence. For our younger kids, that might look like trying to take control of the situations that they're in, managing the kinds of play that they engage in, being really picky about who their friends are, but taking that to a bit of an extreme. And so what that might convey to our children is that The world actually is dangerous. Maybe there is a lot to be anxious about. If mom and dad, if my parents and caregivers want to protect me from everything, like maybe there's a good reason for that. And so that actually reinforces our kids' avoidance. For some kids, as they get older, this may encourage a sense of entitlement of, I don't have to deal with this and you can't make me because my caregivers, my parents, they've got this covered. They're always going to take care of me. And while you want your kids to feel like you're always going to be there for them, what you don't want is for them to assume that you're going to solve every one of their problems forever. So again, like I said, this might limit the child's opportunities to develop skills and confidence to manage potential challenges, because one of the ways that we know we develop confidence is by actually doing challenging things and coming out on the other side saying, hey, look at that, I did it. So similar to the helicopter parents overprotection, I want to talk a little bit about accommodation. So I think this is a more recent term, but the snowplow parent is the parent who does everything to help the child avoid distress. Not necessarily by protecting them from situations, but kind of by accommodating and bending to the will of what their child really prefers. So things like maintaining rigid routines, answering repeated questions, constantly reassuring your child. Again, feels good in the moment because your child's distress goes down, they become less anxious. Don't worry, sweetie, nothing bad will happen. Everything's going to be okay. Oh, you don't want to have a change in your routine. You don't want to do something different. No worries. We don't ever have to change it. That can avoid a lot of tantrums and meltdowns and really big emotions, but it's also not teaching our children that they can be flexible and that sometimes being a little bit uncomfortable is okay, because discomfort is a part of life and there will be situations that inevitably make us feel uncomfortable. So what's the alternative, right? I've talked about some of the not so helpful ways that we can manage our anxiety as it relates to our kids, but there's got to be a better way, and there is. But before I jump into all of the coping skills for how to manage your own anxiety, I want to talk a little bit about getting into the right state of mind to be able to do that. So this diagram here is one of the skills from DBT, or dialectical behavior therapy, which is a modality that I use quite frequently with the families and the clients that I work with. And this talks about 3 different states of mind that as humans we can have. So the first is rational mind. This is a state of mind where we are solely focused on things like facts, logic, reason, and it's completely absent of emotion. So this might be helpful for something like taking a math test or doing a very fact data oriented assignment. Not particularly helpful when it comes to relationships or human interactions, because inevitably emotions tend to be present or at least very important for those interactions. Emotion mind is sort of the other side of the coin. So emotion mind is when we react based on our emotions and our feelings. Our feelings guide our actions, and we can be pretty reactive when we're in emotion mind. And so this tends to be where many of us land when it comes to feeling anxiety. We feel anxious, overwhelmed, distressed. Okay, so let's jump into action. What can we do based on that? Well, maybe we overprotect. Well, maybe we accommodate. And what we've seen in the past couple of slides is this actually isn't super helpful. So the third state of mind, wise mind, is coming at it from a place of dialectics, which is combining of 2 opposites, right? Reason and emotion. These 2 things can coexist by getting into wise mind. We're going to pay attention to the facts of the situation. What's real? What do we know? Things like dates, times, past experiences, what has happened before, but then also weaving in and validating our own emotions, right? How am I feeling about this? Doing a check-in. Is this worry? Is this sadness? Is this anger? And then making a decision about how to proceed. In order to get into wise mind and make a wise mind decision, we can use a number of different strategies. So when we're feeling anxious, I'm going to go over many of the skills that I have listed here. The first of which, and probably the most important of which, is just being aware of an increase in your anxiety. So developing an awareness of how you're feeling in the moment. When I tend to get anxious, do I notice any physiological symptoms? Does my heart start to race? Do I start to breathe really quickly? Does my head start to spin? You know, do I tend to go into a thought doom spiral of all the worst case scenarios and catastrophes that could happen? Maybe it's particular triggers in terms of situations or topics. Only you can know that best about yourself, but developing an awareness of when does this tend to happen for me can go a really long way. The next one that I'm going to talk about is our basic physiological needs. And I feel like this often gets overlooked and people are very quick to roll their eyes and dismiss this and say, oh yeah, wouldn't it be nice to get a good night's sleep? Great, but like what's next? What am I actually going to do? And I want you to slow down and think about how you feel and how you react when these needs aren't met, right? So when we're sleep deprived, when we're hangry, when we haven't moved from our desks for, days at a time because we're busy doing work, we're probably not going to be in a good state of mind to be able to react in the most helpful, most effective way to our own anxiety, and certainly not to our kids' anxiety and distress. So paying attention to getting adequate rest, eating good food, eating enough food, moving our bodies in a way that feels good, that can also go a really long way. And then we can jump into some of these other skills. So one of the key parts of DBT or dialectical behavior therapy is mindfulness. And that's really about being aware and present of the present moment. So mindfulness and grounding can look like a number of different things. There's a number of different strategies that you can use to be mindful. I'm a big fan of relying on our senses. So one easy strategy that you can use is the 5 senses. I tend to do it in a 5, 4, 3, 2, 1 kind of way, where I think about 5 things in the present moment that I can see. Right now, that would look like my computer screen, my water bottle, my coffee mug, my pen, and the clock on the wall. Those are 5 things that I can see right here, right now. What are 4 things that I can touch, right? Going to the next sense. I can touch my sweater, my pen, the smooth surface of the table, and so on and so forth. Then we think about 3 things that we can hear. I can hear my voice as I'm talking. I can hear my sound machine next to me. And I can hear some of the traffic zooming by outside my window. 2 things that you can smell. So I can smell my coffee coming from my coffee mug. And if I smell my hand, I can smell a bit of the hand sanitizer I used earlier. And then the last one is taste. This can be a tricky one. People are quick to say, oh, I don't taste anything. What does your mouth taste like? Did you just have a mint? Maybe you had a sip of water or coffee. And as you're doing this, as you're going through these 5 senses, it becomes increasingly difficult to be spiraling into catastrophes, about what's about to happen. It's really hard to be anxious and to think about all of the upcoming stressors in our lives when we're present and grounded right here, right now, focused on what our senses are experiencing. So the next thing I want to talk about is diaphragmatic breathing. This has a number of different names: diaphragmatic breathing, belly breathing, box breathing. This is just a way to get your breathing under control, because as I mentioned earlier, sometimes when we feel anxious, our breathing gets really quick and it's really high up in our chest. And what we want to do is slow that down and make it go really low. So inhale very deeply and very slowly through the nose, fill your lungs, fill your belly, and then very slowly exhale. Very slowly until almost no oxygen left, and do that again over and over until you kind of notice your anxiety becoming a little bit lower in terms of intensity, you becoming a little bit calmer and a little bit more grounded. The next one is progressive muscle relaxation. I'll talk about that one in a little bit more detail when I get to some of our crisis survival skills. Social support can't be overstated. So the importance of having other people that you can rely on, whether that be to vent, to problem solve with, whether that be to rely on for logistical help, pick up and drop off from school, babysitting. I think it's really important to remember, like, hey, more likely than not, I'm not in this all by myself. So who can I count on? Who can I rely on to help me with some of the distress that I'm feeling? I'm here for my kids. Who's here for me? I think along the same lines, we're very good usually about seeking out therapy, medication management resources for our kids when we feel like they're in distress and they need help. And I think the same needs to be true for ourselves. I think it's really important that we check in and say, maybe I do need to talk to somebody. Maybe I do need to connect with a provider or mental health professional to talk about some of the anxiety that I'm experiencing and how can I best cope with it? What are the strategies that work best for me so that I can be my best self in helping my kids deal with their anxiety and distress? Checking the facts. This is true for DBT as well as CBT, cognitive behavioral therapy. One of the main skills that we teach is checking the facts when our thoughts start to get the better of us. Anxiety is a combination of our physical symptoms, our emotions, but then also our thoughts and behaviors. And so when we think about our thoughts, right, which sounds kind of funny, but it is what we're doing. We have a thought and then we ask ourselves the question, well, is it accurate? What do the facts of the situation say? How likely is the bad outcome that I'm thinking about? How likely is that to happen? What's happened in the past? How bad would it be if the bad outcome did happen? These are just some of the questions that you might want to start asking yourself to help yourself become a little bit more present and a little bit more balanced and rational in the decisions that you're making based on that emotion. The last one is affirmations and mantras. This one can be a bit hit or miss, but if it works for you, I've seen it be very, very effective if you find a phrase or a couple of words that will just cue you in to remember to get into wise mind, right? So it might be something that you see on a quote on social media or on a coffee mug, something like this too shall pass, right? Some people hate it. For some people, it really resonates with them. But the important thing is that it resonates with you and it reminds you to take a breath, slow down, and get into wise mind before proceeding. Okay, once we're in wise mind, once we've addressed a little bit of our own distress and anxiety, how can we help kids manage their distress? So it's no surprise, I think, to most of us that the first thing I'm going to talk about is communication. I think communication is going to be at the crux of much of what we talk about when we're helping our kids, because it's what we say, but then it's also how we say it. Like, how is the communication happening, not just what does it entail? Oftentimes when I work with families of kids who are struggling with anxiety, who do tend to be really anxious, they'll ask me, well, what do I say? Like, what do I do in the moment? How do I respond? My kid just really wants some reassurance and they have all these questions. Do I just keep doing that? Do I just keep telling them it's all going to be okay? That tends to get old pretty quickly and stops working. And my answer to that is that, yeah, there's never going to be enough reassurance that you can give your child that will satisfy their anxiety. It's similar to accommodation, where in the moment it feels really good and it does relieve some anxiety, but then that anxiety does tend to just come right back. And so one of my favorite strategies for this that I think is like a real formula that you can use in your everyday life, it comes from the SPACE protocol by Ellie Leibovitz, which is a program that stands for Supportive Parenting for Anxious Childhood Emotions. And basically what we want to do when our child is expressing anxiety and worry to us is to use a combination of support and confidence. So validation, and then also encouragement or confidence in our child's abilities. So what this might look like is for a child who is anxious about going to school, right? I really don't feel comfortable about going to school tomorrow, mom. Like, I really don't want to go. What if it doesn't go well? Feeling really anxious. What we want to say is something along the lines of, I hear you. It sounds really scary. It's so hard to be worried about going to school tomorrow. And in my heart of hearts, I 100% believe that you can do it, that you can get through this distress. And this is really effective because it combines those two things, right? We're not just validating. Validation in and of itself is super important, but then we're also expressing the confidence that, like, hey, it's hard and you got this. Like, as your parent, I know that you can get through this. We're not promising them a good outcome. We're not promising them, success, or that, their show will go great or that they'll get 100 on the test, because we simply don't know that. But what we can know is that they'll get through that. Something else that's important to do is to model coping skills, right? So there's a reason I put that slide up before getting to you helping your kids manage their distress. It's because kids tend to do as they see, and that is what we say, right? So they are watching you and they are seeing, like, well, what are my parents doing in that moment? And I like to even narrate, I like to encourage parents to narrate what they're doing. If they're struggling with something, if they're feeling anxious, label that and say, wow, that made me feel really anxious. I better take a deep breath. Let me do my grounding exercise. Let me check my five senses. What can I see? What can I hear? Right? Because that can often be more effective than you saying, okay, little Johnny, today we're going to do our grounding exercises. We're going to do our breathing exercises. That can probably make our kids roll their eyes at us and say like, nah, I'm not doing that today. But they might get a little bit more curious by seeing you do it and like you normalizing it for them and saying, well, if mom and dad can do that, maybe I can do that too. So the next thing I want to talk about is problem solving. There's a big asterisk here because if indicated. So sometimes as parents, we are really tempted to go into problem solving mode of like, okay, there's an issue. Let's get to the bottom of it. Let's fix the problem. What are we going to do? What's the plan going to be? And I think that can be helpful to problem solve together with our kids if there's something specific that they're struggling with. However, I want this to only be the next step after validation, right? First and foremost, when we're communicating with our kids, we want to make sure that we're hearing them, right? And that's part of effective communication is just pausing and listening to what our kids are saying without minimizing, without dismissing, without saying like, oh, that's no big deal, don't worry about it, or oh, it's going to be totally fine, right? Just pause, listen. Wow, you sound like you're really worried about going to school tomorrow. You sound like you're really upset about that argument you had with your friends. Just reflecting back what we're hearing, making sure we understand, and then offering up problem solving. Do you want some help dealing with this? Do you want some help coming up with a solution? And then being totally fine. This might be really hard for some of us, but accepting when the answer is no, right? Maybe they don't want help. Maybe they just wanted to vent. Maybe they want to try to figure it out on their own. Most often, I encourage parents to let their kids do that. But then the offer is there. You've offered, right? Like when their own problem solving isn't effective, when they do realize, oh, maybe I do want some help, that offer is there. You're available, you're open, and you're more than willing to help them with that. And then having an open dialogue about the tough conversations, which we'll get to in a bit, but this is so important to have these conversations head on to make your relationship with your child a space that feels safe and available, that's going to be free of judgment, free of panic, for lack of a better word. Kids are often worried that their parents will overreact, that they're going to get really dramatic about the smallest thing that they say. And some of us do, right? Some of that is accurate. We want to communicate to our kids like, hey, you can tell me things and I'll listen without jumping into that mode. So some additional distress tolerance skills that I'll just very briefly review. These all come from dialectical behavior therapy. And these are crisis survival skills. So the purpose of these skills is not to fix the situation. It is not to come up with a solution to the problem. And it's also not even meant to make the situation better. It's just skills that you can use so that you don't make the situation worse, so that the situation doesn't escalate, so that it doesn't become more than what it is right now. You just don't want to make the situation worse. And so what some of these skills are the TIP skills. And TIP stands for temperature, intense exercise, paced breathing, and paired muscle relaxation. So temperature is physiologically changing the temperature of our bodies. That can look like dunking our head into a bowl of ice cold water. That can be, I'm a big fan of those little hand warmers that you see in the winter of like holding something really warm or something really cold to sort of snap you out and into, again, your body, just making sure you're noticing the sensation. Intense exercise can be really helpful. So doing sprints, right? Something really brief, but really intense, can change our physiology. Paced breathing, or, the belly breathing that I talked about, the diaphragmatic breathing. And then lastly, progressive muscle relaxation is when you go head to toe, progressively tensing and relaxing different muscles in your body. So can you tense up all of the muscles in your feet, hold it, and then let it go? And doing it really slowly. There's a bunch of really great scripts online and on YouTube that you can use to do this. But the goal of this skill is to get you more in tune with your body and the physiology of what's going on in the moment so that you can focus on that rather than what your urges are telling you to do in the moment. Improving the moment. This is yet another acronym. So this is all about doing things like using imagery, making meaning, using things like prayer, being mindful. I'm happy to, if you email me afterwards, I'm happy to provide some worksheets and resources about these skills. But it's all about taking the moment and making it into something more than what you're experiencing right now. So using imagery would be to say like, hey, what I'm dealing with right now is really, really challenging. Can I picture a more relaxing place for myself? That's similar to taking the V in improve stands for vacation, taking a little bit of a mental vacation. Right? Can I get myself out of this moment and just picture a really calm, relaxing place for myself? Can I do that for 30 seconds before I react, before I do something else? Distraction. So distracted accept can be really effective in dealing with distress, because even though long term we don't want distraction to be the only skill that we're using for ourselves or our kids, it can be helpful in the moment so that, again, we don't make the situation worse. So that can be something like doing an activity, contributing or volunteering, right? Helping somebody with something. Thoughts. So the T in accept stands for thoughts, or using like, thought-provoking exercises, doing a puzzle, solving a Sudoku. And then the S in accept stands for sensation. Can we eat a sour candy and focus on that just for that moment so that it gets us away from doing something that's super unhelpful? And then the last one, the stop skill, is about stopping, taking a step back, observing what's going on in the moment, and then proceeding mindfully. So stop is really a great summary of how to get back into wise mind when you're already in distress. And so now I want to spend some time talking about how do we distinguish between what is typical behavior for our kids and adolescents and what could be a warning sign that a crisis is going on, or maybe, that our kids may be headed for a crisis. And what I will say about this is that regardless of the age group that we're talking about, what we want to do is look for patterns. No single behavior, I shouldn't say no single, but most of the time, one isolated behavior, one bad day, so to speak, is usually not enough to be a glaring warning sign that something is wrong. And oftentimes parents will say, like, my kid didn't talk to me for a whole day, something is terribly wrong. Maybe. But my hunch is to say, let's see how long has this been going on? What happens the other 6 days of the week? But if you know your kid and you're noticing a change in the pattern of behavior, so they're eating a lot less than they were before. They have completely stopped sharing with you about their days, just altogether. They almost never come out of their room, despite there being activities that they're enjoying happening around them. They're withdrawing and isolating from people and activities that they used to enjoy, or they're in a bad mood where it's lasting for days or weeks at a time, right? Everybody can have a bad day or even a couple of bad days where their mood dips. But actually, especially when we think about adolescence, mood changes and mood swings are actually quite common. So mood swings and mood changes in and of themselves are not necessarily cause for concern. But if they're in a persistently low mood or in a persistently irritable mood, well, that's something to pay attention to. So that's sort of the broad strokes of the kinds of things to look for. We look for patterns. We look for changes in patterns of behavior. And as with everything else, we look for significant distress and impairment. So is the distress getting in the way of my kid living their daily life, right? Is it getting in the way of them functioning at school, of them interacting with their peers, of us coexisting as a family? Does it become impossible for us to be in the same house under one roof? Like, yeah, that would be pretty concerning. And so here I have a bit of a graphic that I borrowed from Very Well, which is talking about normal anxiety versus problem anxiety. So normal anxiety, we all experience, right? At one point or another, we all feel anxious, and I've already talked about why anxiety is important and can be adaptive and functional. And we know that it's triggered by certain events and situations. It's intermittent and it can be beneficial. I feel really anxious before I take a test. That actually motivates me and helps me to study for the test, right? I want to do a good job, so I study for it. Then the exam happens, and then I feel fine. I feel back to baseline. Problematic anxiety is when it interferes with my daily life. It's irrational, it's chronic, and things tend not to help it go away, right? So I stop worrying about one thing, something else comes right along, and I'm worrying about that next thing. It tends not to go away. Okay. I've talked about some of these already, normal versus cause for concern, teen behavior. And I want to focus on teens because adolescence is very much a time where it's hard to tell, like, is this normal, right? Like, everybody hears about adolescents being, you know, stereotypically difficult or moody, and that can be true, but at what point does it become concerning? At what point should I be worried? At what point should I be doing more? So things like wanting to spend more time with friends and not with family, that's pretty typical of teens. Things like worrying about physical appearance and trying to fit in, also pretty typical. Having mood swings where I'm happy and joyful one minute and then I'm worried, sad, and irritable the next, that is typical for teen behavior. Where it sort of crosses over into cause for concern is where I'm isolating completely, right? Now I'm not wanting to spend time with friends or family. I'm just completely isolating and not wanting to be social. I am so consumed with my worries about my physical appearance that now I'm changing my eating behaviors as a result. I'm changing my exercise behaviors, or I am consistently commenting about myself in a very negative way, comparing myself to others in a very negative way consistently. Or, as I mentioned earlier, when mood swings are unusually intense, or when those mood swings last for a longer time. So I've changed from happy to irritable, and now I'm irritable for long stretches of time. I want to talk a little bit about what is a very serious topic, which is self-harm. So self-harm is serious and dangerous. And I feel like when I talk to families, I sometimes have parents tend to ask, well, like, is it actually serious? Like, what does it mean? Are kids just doing it for attention? And my response to that is it's always serious and dangerous, right? And most often it's not done for attention. Most often it's emotionally driven. It's actually a coping strategy, albeit a very dangerous and unhealthy one, but it's an attempt to regulate emotions, to manage pain, to punish oneself, and to reduce feelings of numbness and isolation. Oftentimes after somebody self-harms, right away, they actually feel a sense of relief or pleasure, which is then later on followed by shame and disappointment. And individuals who self-harm tend to be very secretive about it. And, you know, they often try to hide it. They tend to self-harm in places on their bodies where it's really hard to see. And that also should dispel some of the myths around people doing it for attention, because oftentimes they do try to conceal it, they do try to hide it. Another common myth is that everybody who self-harms is suicidal, and that's not true. Sometimes that's the case, but self-harm is not always done with the intent to die. But it's also hard to gauge, especially with somebody who is engaging in cutting. That can lead to a very dangerous outcome where they're cutting deeper or in a spot which is more dangerous than they actually think they are. And so if your child is self-harming, the first step that you want to take is to provide safety, both physical and emotional, and then to connect with a mental health professional, a therapist, psychiatrist. And providing physical safety can look like removing sharp objects from their access, right? So locking up sharps in your house, things like scissors, thumbtacks, knives. And then also providing emotional safety where you're not judging your child, you're not getting angry with them or punishing them for doing this, but rather opening up a dialogue and saying like, hey, let's talk about this. What are you feeling? And really listening to understand. And this is also true for suicidality. So warning signs for suicidality may include expressing feelings of hopelessness, expressing suicidal ideation, and becoming more isolative. And I want to say that, again, a lot of times with teens, parents sometimes can be quick to dismiss it and say like, oh, my child's just being dramatic. Oh yeah, kids say that they want to kill themselves all the time. And my response to that is to please always, regardless of the context, take comments like that seriously, even if they're said in a joking way or even with a smile, or if your child says, oh, I was just kidding, never mind. That's still an opportunity to take it seriously and to explore, okay, so what are the thoughts that you're having, right? Like, there's a very big difference between thinking like, I wish I wasn't here and I don't want to deal with this anymore, to I really wish I could kill myself, right? There are increasing levels of concern with those statements, but all of them need to be taken seriously. Thoughts then sometimes lead to urges. I have the urge to do XYZ. I have the urge to take a lot of pills because I'm really upset right now, which can lead to a plan. This is what I plan to do. I'm planning to do XYZ to try to kill myself. Then the next step is the intent, right? I actually want to do this. And then there's the means. You know, sometimes people have a plan that is not super realistic, and sometimes they have a plan that is very easy to carry out. And so when we're talking to our kids about suicidality, I want us to make sure we're listening for some of these things. I think, you know, and I'll get to this in the next slide, regardless of the context of when this conversation is occurring, if your child is an adolescent, if anyone in your life is expressing suicidal ideation, you know, if your child is talking about suicidality or wanting to hurt or kill themselves, I want you to get them to a mental health professional. I want you to call 911 or take them to your nearest emergency room if they're not able to be safe. They should be evaluated by somebody who's trained to do so. However, as you're talking to them, you want to gather as much information as possible about what are these kinds of thoughts. Is it a passing thought? Is it something they're thinking about all of the time? And how specific is this thought? Is it just a passing wish of like, oh, this is really hard, versus I really don't want to be alive anymore? These are really tough conversations to have. And I think that having a specific list of like, oh, well, what are the kinds of things I should ask about is important. But so is having a game plan for how to have these conversations. So you want to make sure that your demeanor and how you're approaching your child when we're talking about this is calm, clear, direct, non-judgmental, and understanding. And this is so hard to do because this is one of those times where you're going to be feeling so much distress, so much anxiety, so much overwhelm. There's a lot of emotions that can come up with having these conversations. And if we approach it in a really intense, really judgmental, really panicked way of like, okay, well, you know, I can't believe this is happening. How dare you? You know, and you'd be surprised. Some parents do react in that kind of way. That shuts the conversation down. Your child is probably not going to want to disclose any more information if they're going to be perceived as, if this is going to be perceived to them as like a judgmental space or as something that's going to cause you to, quote, overreact. So what you want to do is try your best to stay calm, ask clear, direct questions with the intent of understanding. Well, what brought this on? How long have you been feeling this way? What are the thoughts that you're having? Do you feel like you can stay safe? And so if your child is talking about suicide, as I mentioned, if they're expressing suicidal ideation, I want you to take them to the nearest emergency department or call 911 or 988. But then I also want you to be in contact with their providers. I want you to connect them with a mental health professional. And as all of this is unfolding, as all of this is going on, I want you to stay with your child. So even after they've been evaluated, if they've been deemed safe to return back to school and back to their home environment, then you want to provide ongoing monitoring and regular check-ins about safety. I talked about making the home environment safe by removing or locking up firearms, sharps, and medications. And then, you know, as has been the theme throughout this talk, communicating, maintaining an open dialogue about this. Sometimes when teens or when kids are really reluctant to talk to their parents about these topics, I recommend having a check-in system. Like, okay, you're not willing to have a long conversation about this. Can we make a stoplight system? You know, green means good to go. Yellow means I'm having a rough time, but I'm probably able to keep myself safe. Red means we need to go to the emergency room. I'm not safe. We can do the system based on numbers, colors, what have you. The goal is to have some sort of communication with your child about this. And then on a final note, safety contracts versus safety plans. Historically, something called a safety contract was something that was commonly done where a child signs a piece of paper that says, I will keep myself safe, I will not hurt myself or harm myself. Those, research has shown that those aren't super effective, and they can actually cause a lot of shame and a lot of disappointment for the child if they're not able to uphold their end of that agreement. So what's more effective is something called a safety plan, which a therapist or a mental health provider can often help prepare. And so that includes identifying things like warning signs or triggers for distress or suicidal ideation, as well as a number of coping skills that are clearly laid out that your child can use in the moment, as well as supporters and mental health providers, as well as a number of resources like a suicide lifeline and 988, so that it's all in one place and it's something that the child as well as the family has to use together in the moment. I want to end off with this quote by Marsha Linehan, who developed dialectical behavior therapy. All people at any given moment are doing the best they can. And this is one of the core tenets of DBT. And it's something that I think is important to remember. If you and your child are in distress, your child is doing the very best they can in the moment that they're in, given the circumstances and the context that they have. And so are you. And so it's really tempting to, invalidate our own emotions and judge ourselves and say, oh, I could be doing more, I could be doing better. And that may be true, but I want you to remember that you and your child are both doing the very best you can in the present moment. I have some resources on this slide for what to do if you need help. There's 988, there's the National Suicide Prevention Lifeline, as well as the names of a couple of the different therapies that I talked about and mentioned, reaching out to parenting groups, medication management, and some of the references, sites and books that may be helpful when thinking about these topics. Of course, if you're looking for more support, we are here to help at Small Brooklyn Psychology. So hello@smallbrooklyn.com. You can reach out to us to ask about how we can support you and your family. And I think I'm going to hand it over to Mandy for the Q&A portion of today's webinar.
Thanks so much, Olga. That was fantastic. We, of course, have questions, and I hope we can, let's see, we've got about 10 minutes left to answer some of these things. So one question that I hear quite a lot from parents is, when we're talking about some of these distress behaviors, but particularly things like self-harm, suicide, or just talk about that sort of stuff, how do parents know when kids are not just saying these things to manipulate a situation and get what they want?
Yeah, that's a really great question. And that's one I often encounter when working with families. And it's hard, right? Because on the one hand, you always want to keep your kids safe. You want to do everything to make sure that they're safe. And then if it's something that your child is saying over and over again, it can be tempting to start to dismiss or saying like, oh, there they go again. But actually the best course of action is every single time your child says something like that to take it seriously, whether or not you think they're saying it to quote manipulate you or to sort of get their way. Because if you follow through with some of the steps that I've laid out, so having a serious conversation about it, assessing it, connecting them with a mental health provider, even taking them to the emergency department, best case scenario, you're getting your kids the help that they need in that moment. You're keeping them safe and taking them to a safe place where somebody can evaluate them. So if they were saying it to manipulate you or to just get their way, that's not a particularly fun experience, right? That is going to get old if it's not genuine and real. Nobody wants to go to the emergency department. So I would say follow through as if they're serious each time.
Very smart. It's its own non-reinforcer, I guess.
Yeah.
Yeah. How about things that parents have an urge to do just to check on their kids and make sure that they're safe? So like checking phones, looking through things. I think we all kind of want to do that, but also want to not do that. How do you feel about that kind of behavior?
So I guess it would depend. So if your child has given you no warning signs, no context, no history of them having any sort of concerns about self-harm or suicidal ideation, I would say have a conversation with them of, what is the balance? What's the line? Like, how do I know that you're safe? How can we have an open and honest conversation about this on a line of communication while me still respecting your privacy, right? So maybe that's, I do check your phone every so often, but I don't go through your stuff, or vice versa. Maybe it's you agree to have a conversation with me on a weekly basis about how things are going. However, that conversation changes very quickly if a child is reporting any sort of suicidal ideation, if they're displaying any sort of self-harm. Safety supersedes privacy. Like, that's just the bottom line, right? That sort of lack of trust, that lack of privacy, that can be repaired later on if you're concerned that your child is self-harming and they're stashing things that are unsafe, like knives or razors. Like, it's totally okay to go through their things and find them if it's going to keep them safe. Same thing with checking phones. If you're concerned that you don't know where your child is and you're worried that there might be a danger to themselves, I think it's okay to check their phones and look through their messages, look through their social media. Are there any clues or there warning signs of like what could be going on? So I think context matters in this case.
For sure, safety is important. Going back to the idea of accommodations and things that parents sometimes do to, help kids in the moment, we also kind of do that to avoid big reactions, right? So like, if we don't meet some of these requirements from our kids, they might have a giant meltdown, have like become just completely dysregulated in that moment. Like, what do you do?
I mean, the short answer is like they might, right? Because change is hard. And part of the reason that they want us to do these things, our kids want us to accommodate, is because that reduces their distress. When they're feeling distressed, they might have a big emotional reaction. So I think, like, don't worry that, like, expect it, right? That probably will happen. But then also prepare for how you're going to cope with it. One of the DBT skills that I use a lot is cope ahead. Let's make a coping plan for ourselves for what to do in that moment. I know that my kid is going to have a meltdown and start screaming and crying and saying that they hate me. Hey, I'm going to take a deep breath. I'm going to assume that they're not going to mean that they hate me and that we can talk about it later. And keep in mind that I'm doing this for their best interests. I'm not intentionally trying to, do anything to hurt them or upset them. But I know that if they go to this school function that they're really anxious about, that's going to be for their best interest.
Do you think it'd be a good idea to kind of inform kids about this stance ahead of time, to let them know that this may be something that you are going to struggle with and that's okay, but this is what's going to happen in the moment? Would that be
definitely helpful? Absolutely. I mean, I mentioned SPACE, the treatment earlier for a parental approach to treating childhood anxiety. That's one of the key components. Is if I'm going to switch things up and I'm going to reduce an accommodation, first thing I'm going to do is give an announcement to my kid and let them know, hey, this is something I'll be changing going forward. Heads up, it's not really up for debate or negotiation, but I do want you to know about it. And that's where the supportive statements can really come into play too. Like, this is really hard for you. I get it. I hear you. You're so anxious. You're so upset right now. And you've got this. You can do this. I believe in you.
Sounds good. How do you help teens regulate their emotions in the moment when they are just so activated that they can't get back down? One parent is saying that sometimes teens become aggressive, they follow you from room to room, they just keep arguing, they're not responding to any of the skills that you're suggesting that they take. What do you think is a good idea?
Sure. So again, safety first. If your child is becoming physically aggressive towards you, I want you to make sure that you're able to stay safe in any way that you can. So that might mean removing yourself from the situation, right? If they're safe, and you can be safe in a different room, a different area of your home, I would say do that. I'm also a big fan of engaging supporters in that moment, right? If you know that your child is going to have a big reaction, maybe it's not a great idea for it to be a one-on-one situation when you're having that conversation. Maybe it's great to have another parent, another friend, somebody who can help logistically in that moment and who you can tag team with, so that if you're feeling overwhelmed by their reaction, they can step in and take over. I'm also a big fan of giving it time, right? You don't have to have the conversation to solve the big reaction in the moment. Let your child react the way they're going to react. They will not stay at a 10 out of 10 on anger or, frustration forever. So when they are able to calm down, however they can, right? They don't have to take your advice about doing the breathing and the 5 senses, although that would be great. I would say then once they're calm, have a conversation about like, hey, that wasn't great the way that went down. What can we do next time to make it better? How can I support you? And what can you also try?
So if a teen is raging and not able to calm down in the moment, do you think that maybe parents just need to work on keeping themselves calm and maybe just stop responding in the moment or stop continuing the conversation until they're there?
Definitely. Yeah. Disengage, right? Do not fuel that fire, especially if it's a situation where you may potentially, as a parent, feel unsafe.
Sounds good. One person asks if a teen has expressed depression, suicidal ideation, has a history of self-harm, practices unhealthy coping, but refuses treatment, won't consider taking medication, gives up on talk therapy after a few sessions, isn't really committing to any sort of successful, like really trying any sort of treatment. Do you have any suggestions or advice?
This is so tough. On the one hand, you can't force somebody to engage in therapy. On the other hand, I would not suggest to stop trying. I think that finding a therapist or provider that you connect with can be a bit of a game of trial and error, right? It's not always that the first person you get a session with is going to be the person you click with. And so it's okay to acknowledge that and accept that and say, we'll try again, right? Can you go for one more intake, right? Can we talk to one more prescriber and see like what their take on this is? Because the message that you want to send is like, I'm not giving up on you, right? Like, this isn't okay. You're obviously in so much pain. You're obviously in so much distress. I want to help you. It's hard because oftentimes our kids, when they're in that state, when they need the most help, they can't see it. And so our job as a parent is to continue to support them, provide that hope, and to send the message of like, we're not giving up on this.
Mm-hmm. I think what you said about a trial and error sort of process and finding the right therapist is really important. It's frankly, it's hard to find a therapist right now. There are so many people who are so full. I know that we're full, and so that's always really hard. And so as a parent, when you do finally line up a therapist, you're like, oh, thank goodness. You have a lot of emotion riding on this being a successful thing, so that when there isn't a really strong connection, it can be hard to really think about changing. But personally, I think it's really important because, I mean, there's nothing worse than being in ineffective therapy where it's just like
Right.
dragging on and costing money and all of that. And so people need to recognize that they absolutely have the right, and the therapist will understand if that is something that they feel and they need to move on to somebody else. But also the mental preparation of just like trying again. I know how hard that is, but I think it's really important.
Yeah.
Someone says, a lot of the new gentle parenting things are all about staying calm and validating feelings, starting with parents having meltdowns. Is that its own form of accommodation?
It's a great question. I mean, I guess it can be, right? The skills that I talked about, in terms of keeping yourself calm, that's not the end game, right? That's step one. That's the first thing that we need to be doing. And then we can use other strategies. I think we've had other webinars and talks, and, I certainly talk about this quite a bit in my work with families and with clients, with parents, about like effective strategies for behavior change, right? Effective limit setting, incentives, rewards. There's a lot of behavioral principles that you can use with kids and with teens in terms of changing their behavior. So it's not as though you have to keep yourself calm and like your kid is just running the show, they get what they want. That's not what I'm saying at all. I'm saying in the moment, we need to keep ourselves calm so that we don't make the situation worse. Then we can decide what the plan of action looks like. So it's definitely, in very DBT fashion, it's both and.
The dialectic.
Yeah.
All right. And then in more of a, building kids skills and independence and things like that, but can you think of any just life skills that maybe help give kids more agency in their lives? Anything that we can suggest?
Yeah, I think communication. So I think a lot of times when I work with kiddos who have a lot of anxiety, one of the things that they can get anxious about is communicating with other adults. So whether it be ordering for themselves at a restaurant, to asking for help, you know, scheduling appointments for like older teens for doctors and things like that. I think encouraging more of that is a great place to start because it's a life skill that's not going away, right? We are forever going to have to communicate with providers, with other people, and that can feel uncomfortable. And it's okay if it feels uncomfortable in the moment, because worst case scenario, start over, have a conversation later, right? There's a lot of benefit and very little risk to that, minus the, you know, the distress, but there's a level of acceptance there. Like, yeah, you're going to feel a little bit uncomfortable. That's okay. I believe you can do it.
Mm-hmm. That's really good and like just small but important points. And, you know, as a parent, it's so uncomfortable when the kid is supposed to be ordering a dinner or whatever and just is like frozen. And so your instinct is just to jump in and like say it for them. But there's some of that exposure for the parents too, to just like mind your own discomfort and then give them the space to find their words, even if it takes a while to wait for them to say it outright. And I find that in conversation, difficult, like emotional sorts of conversations with kids too, right? I think that a lot of times kids who have trouble talking about their emotions, as parents, I think we tend to kind of give up or try and guess, you know, what they're feeling, sort of like fill the space with our own words, but we're not really giving them the time and the silence and the uncomfortable silence to be able to like come up with it themselves. And that's a really important life skill too.
I agree. I think that when we're having those conversations with our kids about emotions, it's so tempting to like fill in the blanks when there's just like a beat too long of quiet. And I think it's okay to offer like, well, you seem pretty upset. Are you sad about something? But then don't leave it at that. Don't just like give them the out of being like, yes, I am, or no, I'm not. That's like where you start. And then you say, like, tell me more about that. What else are you feeling? What else makes you feel that way, like in other contexts? So like, listen to understand, listen to learn more, even if step one is maybe offering a this or that kind of answer.
Yeah, that's a good point. And then of course you get to the dreaded, I don't know. But then,
I don't know.
Yeah, I don't know. And then parents are like, oh, fine. And then they just walk away. But, you know, to be able to push and say, no, think about it. Take your time. Tell me something. Even if you're
and you
building
have
up to
those
that skill.
Totally. You have those conversations on repeat. Like one conversation not going well does not mean they're all not going to go well. You have one, you try your best, you let it go. And then a few days later, the next day or the next week, you try again. Hey, how are you doing? How are you really feeling?
Yeah. That's a really good idea. Thank you so much, Olga. This is great. We are definitely out of time, unfortunately. There are still some questions we haven't been able to get to. So if anyone does still have questions, please feel free to reach out. You can email Olga at olga@smallbrooklyn.com. I'm Mandy at smallbrooklyn.com. You can also just email our general hello account if you would like some more information. So thank you, as always, to Park Slope parents for hosting us and helping us to share information, support parents everywhere. And thanks for joining us. I hope you learned a lot, and feel free to check out our other talks that are listed on our website, smallbrooklyn.com/services/talks. Thanks, everyone.
Thank you,
Have a good
everybody.
one.